Okay, so I'm gonna go ahead and demonstrate how to put an NG tube in. Obviously, she is a real person, so I will not be actually inserting it into her nostril today. So I'm gonna go ahead and get started. I'm gonna go ahead and make sure I review the patient's history. I would look at that in the chart, discuss it with the patient as well. I would make sure that there's no recent nosebleeds, they're not on any anticoagulant therapy, any chronic sinus infections like that, any nasal polyps, any aspiration in the past, and I would also make sure that they haven't had any facial or sinus surgery recently. So I'm going to go ahead and make sure I identify the patient with 2 identifiers. I would make sure I tell them the orders and verify that the order is correct for the patient. Then I'll go ahead and make sure I have all my supplies, which all my supplies are laid out here already. So then I'll provide privacy, and I'll perform hand hygiene, which I should already have done that before walking in the room. So my hands are already clean. Then I'm going to go ahead and make sure I tell the patient why they're getting their NG tube. Not necessarily how long it'll be, because we don't really know how long that'll take. And then why, obviously, it'll be removed because we don't need it in anymore. And then I would also make sure I answer any questions for them. Also make sure I tell them that it's going to be very uncomfortable. They may experience gagging, things like that. But I'd also mention also that if they do experience those feelings, to like raise their hand or let me know. So I would give them a little break. So then now I'm going to go ahead and, is it all right if I go ahead and insert your NG tube now? Okay.
Yes, it is.
Okay. So I'm going to go ahead and get started here. You're not experiencing any pain, nausea, vomiting, anything like that? Okay, good. All right. So I make sure that she's already pretty much in the high Fowler's position, but I would make sure that it was that way. Obviously, she is not very up to my hips. I can't move it, but she would be up by my hips. It'd be a little bit easier, so I don't hurt my back. She's in a more comfortable position. Okay, so now perform hand hygiene again. Sorry, I don't have my hand sanitizer next to me. So perform hand hygiene. I have all my tape ready already, so I have 2. I have 1 to make sure I can mark the tube. And then I have another one to make sure I put it onto her gown. And then this one is torn. Oh, I kind of ripped it. But this one's torn into like a little pants kind of thing to make sure it's secured to her nose. Okay. There's that. So now I'll put on my gloves here. Definitely be a little bit cleaner. Sorry, I've had to use reuse gloves, so they're kind of inside out. There we go. Okay, perfect. So now I'm gonna go ahead and look up her nose with a pen light here. Okay, making sure there's no obstruction, making sure there's no nasal polyps or irritation with the mucosa. Make sure that there's no septal defects. Her septum looks good. There's no polyps, there's no nothing. Cool. Good job. All right, so then I'm also going to make sure that I already discussed this with the patient, but I'm going to make sure that I do it again just to be sure. So you haven't had any recent nosebleeds, no nasal surgery or nasal trauma recently or anything like that? Okay, awesome. Okay, so now I'm going to go ahead and check your patency of your nares here, okay? You go ahead and cover one side for me, breathe in. Okay, and can you do the other one for me? Okay, so her patency on her right side is better, so that's the side I would put her NG tube down. So I'm going to go ahead and check your gag reflex as well, but I'm not actually going to check hers because I don't have like a tongue depressor or anything. I'm just going to kind of show you how I do it. Go ahead and stick your tongue out for me, and I stick down there, get the uvula, and then she kind of gagged for me. Okay, good job. Okay, so now I'm going to go ahead, I'm going to make sure I auscultate your lung sounds and your bowel sounds for you, okay? Make sure I know what they sound like before I put it in. So I'm going to take a deep breath in. One more time for me. Okay. Get your back here just a little bit. Alright, one more time for me. Awesome, thank you so much. Okay, now I'm going to go ahead and auscultate your bowel sounds, okay? Make sure that they're working. Okay. So after I do all that, I'm gonna go ahead and measure the tube now. Okay. So I would make sure I get to the tip of her nose here, behind her ear. Sorry, Ellie. Behind her ear. And then I would measure it down to her xiphoid process. Right about there. Then what I'm gonna do is I'm gonna make sure I mark it with tape so I know how far I'm going in. This is not working out very well, but it's all right. There we go. Okay. All right. So now I got the tube here. All right. Then I'm gonna go ahead and I'm gonna lube it up here. Just kind of get it all lubed up there. All right, are you ready? I mean, you're gonna feel some discomfort, okay? But if you need a break or anything, just make sure you let me know or stick your hand up, okay? I'm gonna also have you hold this for me, all right? Okay, you ready? Okay, so I go in and I make sure I go up towards her ear and down. Sorry, it's a little weird not actually putting it in. And then down, so then once I get back towards the back of her throat, I'd make sure I have her put her chin to her chest and go ahead and drink for me, okay? And keep going. Keep going, keep going. Keep going. All right, sorry, it's a little difficult. Okay, now it's at her nose. Okay, good job, Allie. I can take that for you, okay? All right, so then now I would secure it. I have the tape, but I'm not actually gonna secure it to her face. But it would be secured to her face using the like little pants looking tape I have. So then that would be there, okay? Oh, I don't have the syringe attached. Okay. So actually the syringe would be attached to this already. Okay, I'm gonna set that down there, okay? All right. Now I'm gonna listen to your lung sounds here, okay, real quick. Make sure I didn't get into your lungs there, okay? Deep breath. Another one for me. I'm gonna get another one back here, okay, just to make sure. Awesome. They sound normal, so that's good. Okay. So now I'm gonna go ahead and I'm gonna take some of this juices out, make sure I am actually in your stomach, okay? Put it in here. Okay. Get my little pH thing here, and I dip the little guy in there. Okay. Then I'd make sure I match it. It needs to be either from 1 to 4, and it's at a 4. So I got her her stomach, which is good. So then now I'm gonna go ahead and I would attach this to her gown here. Okay, just kind of, sorry, Ellie, I'm gonna tape it there. And then I would connect this tube here to make sure that none of the juices come out. Okay, so now that's all taped up there. And that would be obviously there and down her throat, obviously. Okay, so now I'm gonna go ahead and I'm gonna remove it now, okay? So I would just take all the tape off. Apology for all the tape, you know. Then I'm gonna go ahead and make sure I take it off the gown here. My tape there. Okay, so then now I'm gonna go ahead and say, okay, so it's gonna be much easier taking this out this time than it was putting it in, okay? So what I'm gonna need you to do though, actually I'm gonna put this towel on you. Okay, it'll help a little bit. Okay, all right. So it's gonna be much easier, okay? So all I'm gonna need you to do is I'm gonna need you to hold your breath and I'm gonna just pull it out, okay? You ready? 1, 2, 3. Pulling it out, pulling it out, pulling it out. And I grab it. Okay. Make sure that the tip of it, all of it's intact before throwing it away. Just make sure it's not in the stomach or anything like that. Get her a towel or something to wipe her nose off with, because I know that's probably gross. Some more water would probably help too, because you did just pull all that out of their stomach. So then I'll go ahead and take my gloves off. Throw them away. Okay. Perform hand hygiene. Then I'm gonna make sure I reassess her comfort level. I'll make sure the side rails are up, the bed's lowered in the lowest position. Make sure it's locked. Make sure that her call light is in reach. And then before exiting, I would also make sure I perform hand hygiene as well.